Thank you, Mr. Chairman. As we all know and we've been discussing, we are in the middle of a pandemic that has killed more than 470,000 Americans in less than a year. We know that access to healthcare at this moment in particular is vital. Yet for too many Americans, healthcare is still inaccessible. Too many people cannot afford the care that they need. No one should have to worry about affording the healthcare that they need, especially right now. For years, we've grappled with the question of how we can ensure Americans have access to affordable healthcare. And over the past year, the pandemic has underscored the essential role that healthcare plays in our lives, the importance of the health of our neighbors in our communities, and has highlighted the inequities of our healthcare system. I agree with my colleague from Texas, Mr. Vesey, that one vital part of the solution is to get states to expand Medicaid, states like ours. And I'm glad to see that the legislation that I've introduced to increase the FMAP by 5% is included in this bill. And I support Mr. Vesey's efforts to have a more permanent expansion as well, and look forward to this committee continuing to address how we can expand Medicaid. Because expanding Medicaid would provide access to care for millions of people across the country. And in our home state of Texas, it is vitally important. Quite simply, Texas is in a healthcare crisis. Texas has the highest uninsured rate in the country at 18.4%. This is in stark contrast with other states like Massachusetts that have only 3%. And sadly, according to the United Health Foundation's annual rankings, Texas ranks 50th in the country for access to care, and it ranks highest for people delaying treatment because of cost. And all this is happening in the shadow of incredible high quality healthcare and in the shadow of some of the most innovative medical research at leading healthcare institutions, not just in our country, but in the world. I represent the physicians and researchers and others who work in them, including in the largest medical complex in the world. At the same time, we see that far too many people don't have access to that care. Currently, there are 4.1 million Texans enrolled in Medicaid, and an estimated 1.2 million Texans would be eligible for coverage under expansion, including an estimated 223,000 residents of Harris County. One study found that Texas could have seen a 24% drop in uninsurance if it expanded its Medicaid program in 2020. Medicaid expansion is critical during this pandemic, where so many have experienced devastating job losses. An estimated 650,000 Texans lost their health insurance because they lost their jobs during this pandemic. States that reject Medicaid expansion are rejecting a huge amount of money on the table. A study by Texas A&M researchers last year found that expanding Medicaid could bring as much as $5.4 billion federal dollars to our state. So there's so many reasons to expand Medicaid, and expanding in Texas will help protect more than 1 million people in our state and support our hospitals. It's so popular in Texas too, with one survey last year finding that 67% of Texans surveyed supported Medicaid expansion. And so at this point, these provisions are vital to helping incentivize states like Texas and the others that have not yet expanded to do so. At this moment in our history, it's critical. Ensuring that every family has access to quality healthcare is critical for helping families through this life-threatening pandemic and moving our country forward. Our economy can't recover until our people recover. And in states like mine, expanding Medicaid is an important part of that effort. So thank you, Chairman Pallone, for including these important provisions in the legislation before us today. I encourage all of my colleagues to support these provisions, and I yield back.